Welcome. This is the BN Mentorship Network event for BN recipients, so the bursary for internationally educated nurses, and we are going to get started. So today we are going to have just a quick chat about our HPAP and the supports that we provide, and then we'll have Lydia from Alberta Association of Nurses chat, and then we'll wrap everything up with a short survey and a Q&A session. All right. So the BN program is funded by the Ministry of Advanced Education, and RHPAP administers the BN program, and then I get to support the day-to-day operations. So I wanted to share a bit more about RHPAP and the ways we support rural healthcare, because it speaks to why we were chosen to administer this BN program, and that its purpose is to bring rural nurses to the communities that are in need. So it's been such a great fit, and I think we often miss that whole overview. We always talk about just BN, but I really want to get the bigger picture of how RHPAP as an organization can support you. So RHPAP is the only organization in Alberta that operates across the full rural workforce life cycle. So we have high school events to encourage careers in rural health. We partner with post-secondary schools, and we fund physician, nurse, and allied health trainings. We support community integration, and then with community consultants across the province, we encourage attraction, integration, and retention of rural healthcare workers. So through trusted relationships, system partnerships, and evidence-informed programming, RHPAP bridges government priorities with community-led action to ensure healthcare stays close to home. So the rural landscape, nearly 18% of Albertans, so about 900,000 people, live in rural or small town communities. And these populations are spread across vast geographic areas, often far from major health centers. So while rural Alberta accounts for nearly 1/5 of the population, it has less than 10% of the province's physicians. This imbalance is one of the most significant challenges facing rural healthcare today. And this disparity is also reflected in the job vacancy rate of RNs and LPNs in less accessible and rural communities. So rural residents tend to be older. They have higher rates of chronic diseases, including diabetes, cardiovascular disease, and respiratory conditions. And this naturally increases demand for both primary and emergency care. These factors combine to create higher risk for rural patients, particularly during medical emergencies or when timely care is critical. Strengthening rural healthcare across access is not just about workforce numbers, it's about safety and equity and sustainability for rural communities. Okay, so what does this data tell us? You can see on the left here, I pulled some quotes from an article in 2026 from the Calgary Sun. And they say the overall nursing vacancy rate is now under 10%, which is a decline of about 3 percentage points. While competition for nursing positions in some areas sees more candidates than available positions, other areas, especially rural and remote communities, continue to have staffing issues. And that is a quote from the AHS spokesperson. And then here is a chart from the 2024 Statistics Canada. And it's showing that the job vacancy rate for less accessible, this brown bar, and the gray, which is the remote, it's much higher than accessible, so urban areas. So I wanted to share this data with you as an encouragement that your expertise and role as a nurse is needed and valued in rural Alberta. And we're here to support you. So it's my full-time job to administer this BN program, and I'm here to support you throughout your BN journey. And I do that in a variety of ways, including events like this, the BN Mentorship Network events. And I also send you monthly updates in your inbox. They include important updates, resources, and event invites. So often Lydia, who will be speaking shortly, will share invitations to her events, and then I'll include those in the BN update. So your BN update will be a PDF document, but I'll have just a summary in the email. So if you just want to browse that and then see if you want to take a look at the PDF, which I encourage you to do so. And then every month I have an office hour, so you can just pop in to that Zoom meeting and we can chat face to face, or we can share our screens to get some. Sometimes it's just helpful if you have questions about the BN map or about your contract, we can go through it together. Of course, I'm available over email at bn@rhpap.ca, or you can call me at 403-768-2066. That phone number is always in my e-signature, so you always have access to that. And you can call me anytime because it's my work number. So I will just see that I missed your call, or I'll receive your voicemail and I'll call you back whenever I'm out of a meeting or whenever it's work hours. So don't hesitate to reach out to me at any time because I want to be there to support you. And I love getting questions from you. And then I just wanted to mention our event, our biannual conference that's happening this fall. If you would like to join us, you're more than welcome. There's more information about registration in our BN update that was sent just a few days ago. So last week I sent that out on the 1st, and you could learn more about it there. But okay, that's all I have to say. And now I'm going to hand it over to Lydia, the internationally educated nurse navigator with Alberta Association of Nurses. She is amazing. She's a vast source of knowledge. So I'm really excited to hear her presentation. I know it's going to be very helpful.
Thank you so much. Thank you.
Of
I'm going
course.
to share my screen. It's a delight always to be with you. And I'm going to be talking about the pathway to practice as a nurse in Alberta. So I'm going to share my screen. Let me make sure I share the right one. There we go. Okay, so that is what we're going to be doing. And you will see my name and email on there too. So that's where we're going to start today. So as we go through this, I might skip through some of the slides because as I was talking to Abigail a little bit before we got started, I know that you've had some recent discussions from the regulators, meaning CRNA and CLHA, about the registration pathway. So I might skip through some of those a little bit quicker, just so that we can get on to some of the more important, or not more important, but the more relevant things that we need to cover today so that we don't overlook those things and run out of time. So let's move on. Whenever I do a presentation, I always do a land acknowledgement, just to acknowledge that very special land that we are all living in Alberta. So in the spirit of truth and reconciliation, the Alberta Association of Nurses acknowledge that we live, work, and play in the province of Alberta. We acknowledge the traditional lands of the First Nations Treaty 6, 7, and 8, Métis regions, and the Inuit people. We recognize the Indigenous people who for generations have been the traditional keepers of these lands. So just a quick recap. Probably by now, you've come to realize there's a variety of nursing organizations across the province of Alberta. So this table is just giving a quick summary of who's who and what do they all have to do with nurses in Alberta. So I just want to do a quick summary for you, just to kind of clarify what each person does, what their role is, and how they affect or how you fit into that as a nurse in Alberta. So first of all, I'm going to go back to the regulator, and those are the licensing bodies. So that is CRNA, CLPNA, sorry, I'm going backwards, CLHA, and the CRPNA, the Psychiatric Nurses Association, would be the major ones that you might come across. And that is where you would have got or are in the process of getting licenses as a registered or licensed practical nurse in Alberta. And their whole focus is the registration or licensing of nurses. So why did they do that? They create a registration or licensing process, but their mission for that is actually to protect the public. It's to ensure that someone doesn't just wake up one day and say, ah, I'm a nurse. I'm going to just decide all by myself that I am a nurse today. I just woke up, I decided it, and I'm going to, from now on, put the initials RN or LPN after my name and are going to apply for a job as an LPN. I have no training, but I just decided it. So the whole purpose of the regulators is to ensure a common standard of practice, a common standard of education, and what people can expect, the public can expect if someone is a registered or practical nurse or a psychiatric nurse in the province of Alberta. Those standards are similar from province to province across Canada, but that is the role of our regulators. They license or regulate the nursing profession, but the primary focus is actually the public, is to protect the public, to make sure those of us that claim to be nurses or are registered or licensed nurses actually are who we say we are and have the qualifications to do that. Similar regulators also regulate other healthcare professions, such as physios, pharmacists, physicians, etc. Being registered or licensed in a province is required. You can't actually practice as that healthcare profession, in this case, nursing, without it. And by now, you're fully aware of that. You actually have to have a license, it's not optional. The other one I want to cover is the union. Now, a union for an employer actually is nursing orientated. So you may find that when you go to work for some of the bigger employers, particularly, that they have nursing unions. You might have heard on the news about nurses being on strike right now or creating job action. The nursing unions do fight for the well-being of nurses. They create safe workplaces. They make sure that nurses are working in environments that are safe. That's safe equipment, safe work environments. They work to establish that nursing is a safe environment. Not perfect by any means, but they do have an interest to create safe, equitable, fair workplaces, and that the nursing wages and contracts are negotiated for the best interests of nurses in that environment. There's a lot more to that, which I don't have time to cover today, but that's the general purpose of a nursing union. The requirement to participate is required in an environment where you're employed, where the employment is a unionized environment. So if you went to work for an employer like the former AHS, so Acute Care Alberta, for example, or Covenant Health, you're going to find that the employment there does have the requirement of belonging to a union, and it isn't optional. You will find that your paycheck does have a subtraction of union dues, and your employment does require that you belong to the union. If you're employed by a smaller employer, some of the smaller long-term care facilities, for example, union membership may not be required because it's a non-unionized environment. So there are some exceptions, and that's why you're going to find a star there. So the audience for the operation of the union is the union members, which is our nurses. The employers, their whole existence is for patient care. They are designed, their audience is the patients. They exist to provide patient or resident care. Our participation as nurses is voluntary. We don't actually have to participate with the employer. Although you may say that's not actually true. I need a job. And most of us do need jobs. But we do have the option to apply or not apply for that position with that particular employer. So that's why it's classed as voluntary. The employer's role in terms of how it affects nurses is that they hire nurses and they pay nurses for the work that they do. So that brings us back to AN, where I'm employed and what I do and what I work for. So the Alberta Association of Nurses, what do we do? Our whole existence is to advance the profession of nurses. We exist for the whole purpose of nurses and the nursing profession. No one is required to belong to the Alberta Association of Nurses, although we would be delighted if you did. Our membership is quite significantly less than the other membership dues. It is just about I think it's currently $88 a year. And it also includes membership to the Canadian Association of Nurses. And our audience or our existence is totally for nurses and the nursing profession. So I hope that clarifies the difference between those. So, what do I personally do? So, my role is specifically for assisting internationally educated nurses. And this morning I was talking to somebody about the variety of things I do, and it's really broad. And even this doesn't capture all of the different things I do. I meet with government, I meet with schools, I meet with Abigail and her team in terms of I'm very passionate about rural nursing because, as in my early career, I worked in rural, and I really encourage you. Rural nursing is a great rewarding place to work. And I can't encourage you enough for choosing this journey because it's absolutely one of the most rewarding things that I ever did in my career. So if you want encouragement for that, definitely come and chat to me because rural nursing is a fantastic pathway to take in terms of nursing. So what do I do? I help individual internationally educated nurses with everything from registration processes, resume writing, interviewing, and applying tips. So what I do is quite often is I help people with their resumes. I've looked at thousands of resumes over the years, and I can tell if somebody has copied and pasted it off a site, whether it looks genuine, whether it speaks of you, whether it's got mistakes in its spelling mistakes. Really check for those spelling mistakes. We're going to get onto that. I practice resume. If you've got an interview for a job, I will do mock interviews with people and help them get their nerves out and practice questions that might come up for that specific job. Depending on the job that you might be interviewing for, different people will ask different types of questions. So practicing the interview can be really helpful. So there's lots of tips that we can look at with that. Information, I give all kinds of information in terms of where to apply, what to do, additional courses that can be helpful. NCLEX preparation, of course, I would imagine that many of you may have already done NCLEX. A big thing can be about cultural and settlement agencies, but also when you're thinking about, moving to a rural community, what does that look like? What might I need to know? I'm sure that Abigail and her team might be talking about that, but there's a lot of things that I do that help with the bigger picture of life. So I'm about talking to nurses about nursing career, but you're also in the context, you're a person with a family and a life. And what does that look like? And how does that intersect with your actual career, your employment strategies, and all of those pieces, as well as some goal setting? Where do you go from here? I'm going to skip over this one. And we're going to skip over that because we've talked about regulation. So once you are ready to start applying for jobs, when you're sort of thinking about, okay, I'm doing my bridging program and I'm looking at those rural pathways, what is it that I'm going to be thinking about next? And this is a good time to be thinking about that. There are so many opportunities in what is classed as rural in Alberta, but you really want to start thinking about what does my resume look like? So you want to start thinking about creating a resume. And I'm going to give you some examples of that in just a second. And you're welcome to send me your resume to have a look at. And then next comes finding employment opportunities. One thing I'll tell you off the bat, think about your non-negotiables. Think about where you would like to be, but also think about what isn't going to work for you and be realistic about that upfront so that you can hone in and focus on which communities, where is going to work, especially if you've got children or family members, and really think about where do you want to get to and, think about vehicles and those kind of things. And then you're going to start the application process for each that you're going to meet and what matches your skills. So the type of sites, the type of resources, does it have an acute care facility? Does it have long-term care? What are my skill sets and where's going to be the best fit for me? And then you're going to prepare for the interview. So definitely in your I'm sure I'm looking at Abigail, but they're on the IHPEP website, they've got profiles for different communities, which I often share with people because they're fantastic. It's like doing a guided tour of um, looking at different places that you can look at. So a lot of the things I find is depending where you've come from, different people have different ways of writing resumes. But we also have a very set way of doing resumes in Canada. And so looking at that and asking for support can be really helpful. And we have a career center at Alberta Association of Nurses. So I don't know if Abigail can copy this and put it in the chat while I'm busily chatting away here, or do you need me to do that? You got it? Thank you so much. Cover letters can be useful, but they're used a lot less often than you would think. We can definitely talk about that. But the biggest thing is just a concise and strong resume. The main thing to really be aware of is long resumes are not it. Being concise is really important and making sure that the order is right. You do want to have a list of references, but they don't actually need to be on the resume itself. So I'm going to give you some examples. Okay, so this is an example of what a good resume would look like. And I want you to take some note of this. And I'm going to point out why this is good. So first of all, it's not busy, doesn't have to have a whole lot of fancy color and fancy graphics on there. It doesn't contain a picture. So quite often when I get resumes internationally, they sometimes contain picture. You don't need to have a photo on there. And it's important about what it does contain. You want to try, if possible, to keep it down to the one pager. It doesn't need to tell me that you had a babysitting job when you were 12. That doesn't need to be on there. But what it does have is this impact statement, just a brief summary at the top. It contains the person's name and contact information. Then it has professional experience. And what you'll notice is it goes in most recent first. And it's focused on their registered nursing experience. So if you've got experience that is non-nursing, it doesn't necessarily have to be in there. So if you've most recently been working at Tim Hortons and done some other jobs, you don't necessarily have to have that on your nursing resume. You might have a secondary resume that contains other things, but it doesn't necessarily need to be on your nursing resume. How many pages required for the resume? One. Ideally one, maximum of two. Yeah, it's got it right here. No more than 2 pages in length. Ideally just one. And I'll tell you why. Most managers, HR people, are not going to spend time reading a lengthy resume. You'll also notice here the bullet points. It's just, and the summary statements. The other thing that I spend a lot of time coaching people on is you don't need to put under a registered nursing position things that are obvious that every nurse should be doing. So, for example, under a registered nursing position on your resume, you don't need to add things like administered medications accurately. It would be an expectation of every registered nurse to administer medications accurately to their patients. You don't actually have to include that. Or monitored vital signs using certain equipment doesn't need to be on your resume because it would be the standard expectation of a registered nurse to be doing that. So what you will see here is it says provide direct quality care to patients, including daily monitoring, recording, and evaluating medical conditions up to 20 patients per day. So this is giving an overall summary statement. And then you've got the next thing, developed and direct a rotational system in managing the care of patients in the department. Coordinated workforce management objectives with a focus on individual development and hospital-wide initiatives. So what the person's doing is highlighting achievements or personal highlights of their role during that experience rather than stating the obvious or stating basic expectations of the average RN. If you don't have anything specific to put, that's quite okay. You don't have to make things up. The other thing that is important is it's got to be genuine. So don't just start writing a bunch of things just to space fill. It is better to just write the name of the hospital, registered nurse, and on a medical unit, and the length of time, and not put anything underneath, than add things that don't sound genuine. Because people will see through that and then think this sounds disingenuous or doesn't sound real. It sounds fake. And then that won't make your whole resume. They'll be like, this sounds fake. I'm going to pass on this. So it's much better to actually just put registered nurse, this hospital, on the date than put copy and paste things in that aren't actually realistic or aren't actually genuine. Does that make sense? More isn't necessarily better. Real is better. What you do want to add is certifications and special training. So your bridging programs are going to be part of that. But if you've done CPR, if you've done language training, if you've done interrelation, anything that you've done training wise can be valuable, but it will go down here under certifications or special training. Education is always major education. So your bridging program or your main nursing education is going to go in here. You don't need to put elementary school. It's basically your nursing education that's going in here. Do not forget to proofread or check for typos. Nowadays, there's no excuse for this with Copilot and with spell check and all the different things. But you'll be amazed how many I receive that have got multiple typos or formatting errors. And I'll receive them after they've already gone out to people. So do watch for that. So cover letters, when do I include one? What should I say, do's and don'ts? Okay, let's have a quick look at cover letters. So the biggest thing with cover letters is you want to include all the relevant information, like including your name and address, the current date. This might seem obvious, but you'll be surprised how many times I've received a cover letter that's actually got a random date on it. So, for example, today's date's the 7th of July, 2026. I, I'm going to make it up to make it relevant today, but the scenario is still relevant. So, I've had circumstances in my career where I would have had a cover letter that would have been 6 months or a year out of date. So if it was today, I could receive a cover letter with a date that said May 17th, 2025. So immediately, you know that people are just copying and pasting something. That just doesn't speak of professionalism. It's also a giveaway that people are just sending things out randomly and it speaks of not being professional. So you have to be like those little details also speak to, is this nurse someone that pays attention to details? So if you're not paying attention to the details of the date on your cover letter, are you going to pay attention to details when it comes to charting on your patient? Are you going to pay attention to details when double checking medication? It might seem like it's not a big deal, but if you're not paying attention to that detail when you're trying to get a job, I'm not going to be as inclined to even pay attention to your cover letter if you're not paying attention to detail on that. So it does matter. So be cautious on reusing things and not taking the time to do double checks on things like that. Same with this, employer name and address. You can reuse the body of a cover letter, but don't send a cover letter to Covenant Health that you've also used for Acute Care Alberta and not change the name and address of the employer. Again, you'd be surprised how many times Covenant Health gets letters that are addressed, dear blah, 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 and the address and information speaks to Acute Care Alberta or vice versa. Again, it shows that this person isn't being professional, they're not doing their homework, and this is a real put off if you don't pay attention to these details. It is better not to send a cover letter than not get this piece on point. Don't send one if you are going to not pay attention to this piece. These are actually big deals. Use a formal salutation. Culturally, I get greeted with a variety of salutations when people send me emails. I'm okay with that. But in a formal cover letter, you've got to use the right salutation. Dear sir, dear madam. You can't use a casual or inappropriate or dear, whatever the person's name is, if you happen to know there. So if need be, get a mentor or mentor to actually look over this for you because you don't want to be using an inappropriate greeting. The actual body of the cover letter itself should be no more than 1 to 2 paragraphs, and with the concluding paragraph. But the concluding paragraph is brief. It's usually a sentence. It's not lengthy. So and a formal closure and signature, and it should be typed and signed. Most of them these days are electronic, they're on the computer. And it's a maximum of one. This is not a lengthy, this is not your life story. It's formal. You introduce yourself, why you're the best candidate. It has to be true. This is not an embellishment of your life story. This has to be genuine. And why this fit or this unit is the right fit for you, a summary with a thank you. You're thanking the person for considering you for the role and for reading your application. You can reuse the cover letter. Don't forget to change the details. Do mention personal experiences, but only those that are not included already in the resume. Do not ramble or rewrite your resume. So what you don't want to be doing is just being very wordy. Copilot can really help you with this. So use the tools that are available. I want to just pause here for a second, but a lot of these aren't particularly rural. So what I'm going to do is I'm going to encourage, again, I'm more than willing when you are at the searching for positions phase to not hesitate to think outside the box and to be aware that employment is diverse. There are many, many opportunities within the rural network for employment. And I'm more than willing to help people with that role finding and to think about, what does that look like? How can I get connected? I also work very closely with the employers and thinking about your skills, thinking about your reviewing your resume with people and really getting down to why am I practicing those interview skills. But it does take you being aware of what do I need to do to make sure that I own my own practice, own my own resume, own those skills. So my contact information is up on that screen. I want to make sure everybody is very much aware of it. I'm as invested in you finding jobs. I celebrate every time somebody gets a position. I really get excited over it. So I am as invested, but I also don't want you making mistakes that are unnecessary. So, Abigail, if people want to open it up to questions, let's go over to that
Yeah.
now because I'm sure people have questions.
Yeah.
I
Thank
tried
you,
to
Lydia.
focus
So
in,
that was
yeah, on
great.
those.
I often hear from recipients that they've applied to 80 to 100 positions, and I really value what you're saying because we want to make sure that we're giving out really high quality app applications because then
Yeah,
you're more likely to be successful, and that's what we all want. I am the same way. I
yes,
also celebrate when my recipients find work. It's wonderful, and I'll share with my team, and it's just we are cheering you on. So, before we dive into questions, I'm going to launch our survey, and this just helps us create our next event. So, you can let us know if this was what you were looking for and what you would like to hear about next time. Last time we had this survey, everyone was wanting to hear from associations. So that's why Lydia's here. So we really do listen to your feedback and we want to make these events as helpful as they can be. And I am happy to come in the evening if that timing works better for you, or we can keep going with noon. So, yeah, I'd love to hear your feedback. And if these questions don't capture your comments, then you can always email me or give me a call too. So, Lydia was saying that there are lots of opportunities to get creative about finding employment. And I do just want to touch on that as well. So, here we have our Bien webpage. And if you scroll down, you'll find our eligible BN locations. So you can see the list of communities. That's over 450 eligible communities for you to work in. But if you go back to our webpage, there is an interactive map and we have some filters. So we'll check off the BN communities. You can see where the AHS facilities are across the province. There's about 100 of those. Covenant Health, Connecting Care, Extended Care, Bethany Care, Manoa Delac, and Shepherd's Care. And these are only their locations that are BN eligible. So this can be a really great tool for you to narrow down your search, like Lydia was
Mhm.
saying, being really intentional about which locations would work for you. If you're not interested in working up north, then maybe don't focus on those and we can look down in the south or in the central zone. But we want to make sure that it is a BN eligible community because the worst thing is when someone tells me they got a job and it is not BN eligible. It's just heartbreaking. So I just wanted to share that. And if anyone has questions about that, you're welcome to chat with me. That isn't an exhaustive list. So there are quite a few filters on there, but there's other opportunities. So working at a small clinic as a nurse, that would work, or being a travel nurse. It's kind of hard to capture some of those things on the map. So did you have any other opportunities you would add to that, Lydia?
Yeah, I think the biggest thing is just recognizing that in rural communities, it's a great skill developer, is that the opportunities to grow as a nurse is what I was the most passionate about when I was working in rural nursing, and what colleagues that I've had that would the sense of community, the sense of family, the
Yeah,
sense of the skills that you develop, as a rural nurse, from across the board, and the learning opportunities moving forward, from emergency to maternity to long-term care, and the diversity of I get so excited about those things. I am really passionate about it in terms of what that does for your ongoing nursing career is absolutely fantastic. It's
yeah,
it's probably the thrill of my nursing career. And I've worked in, sometimes when people think about, oh, you worked for Stars, you worked at Children's Hospital, as if that was the big deal. That was actually not the highlight of my career. It was actually working in rural. And that people don't realize that, that the difference in terms of working in rural was much more exciting than working for Stars. Like people don't wrap their heads around that. And that's actually the things that I loved about working in rural. Working in rural is much more exciting and thrilling and passionate. And, I think of nights when I worked in rural on night shift and would go outside the emerge doors and the stars would be up. And this is when we actually had, even quieter moments. And there's something just so beautiful about those moments, like at 3, 4 in the morning when it began to settle down. And it's just beautiful. For sure, there were moments of 5 or 6 when someone came in with chest pain and you're by yourself, it's less. But it's it's lovely.
yeah. And
Absolutely.
those sentiments would be really valuable on a cover letter too. So talking about what you hear
Yes.
from other people, from mentors about working in rural and how it's rewarding and challenging and that you're up for the challenge, that you want to be a part of this community and that you're here to stay. That's what hiring managers would
Yes.
love to hear. So make it
Yeah.
personal.
Yeah,
Wonderful.
exactly. And that's really the heart of it. And that's actually what, and as I said, I've over the years, I've read countless of other letters. I've hired countless of members of staff, not just nurses. I mean, I've hired physios and social workers and, RT, all kinds of different staff. But it's oftentimes it was the passion of the person, even more than the skill of the person, that often drew me in and said, I've got to have that person on my team because it's about exactly that. It's like they really want to be here. They want to be part of this team. I can teach people skills and those kind of things, but you can't teach people passion. And that often can be the biggest thing that can come across when your letters are genuine, when your heart is genuine. So although there can be, like I've talked about the one page of the framework and those things, but when when someone reads in a one paragraph, I have these skills, but my heart is to be in a rural Canadian community and I want to raise my kids in that environment, that can actually be the thing that will get you the job because it's it's that like-mindedness, it's that sense of community that will, because if that resume is coming at the same time as a resume that's flat emotionally, um, sometimes it's those things that are going to make that big difference in terms of that piece.
Beautifully said. Do we have any questions? Lydia also, as you could see from the slides, knows a lot about the registration process. So I know we chatted about that in
Yeah,
our
ask
last
me
event,
anything you
but
like.
yeah, she knows everyone. Anytime I meet with a new organization, they're like, "And have you chatted with Lydia?" Yes, yes, I have often. We're all huge fans of her because she's so incredibly helpful
Oh,
and cheerful to boot. So,
yeah. You can ask me anything you like. It doesn't have to be on my slides. I was just, sometimes it's keeping me quiet and keeping me to my time, which is the challenge. Um, just while we're talking, I've got various webinars that are always available and a community of practice that's available and various resources. So feel free, to, I
I
don't put people on the spot.
I have
People,
shared about your community of practice. So
yeah, it's
correct me if
open
I'm
to
wrong, but
everybody.
you meet twice a month, one during the day and
Once
one
a
in the
month.
evening. Okay.
Yeah, it is twice, but it's on the same day.
Yeah.
So July 20th is the next one. It's currently on Mondays, and we meet once at noon and once at 7 p.m. So trying to capture when might work best for people. But yeah, the idea of it is to talk about practice issues, but also as a sense of community for all internationally educated nurses and to really steer it towards whatever things are most important. Right now, we're doing a series on communication, but we're open to whatever people want to raise or to talk about, or keeping it mainly to practice orientated issues. But yeah, a sense of
Well,
community is really the overall goal.
yeah.
Yeah. Oh, there's a one who popped up. Let's see. Let's see. Is an English proficiency examination required for the transfer? NCLEX license from the United States. English proficiency isn't required for the NCLEX, but English proficiency comes in really to do with the licensing itself. So, and it really depends on the country that you originally came from. And there's several factors that come into it. Let me just do, do, do. It will depend a bit on what country you originally trained in and what your native language was. And so, for example, and if your education in nursing was done in English, oftentimes you don't need to do English proficiency. And um, if you didn't do your education in English, then sometimes that is required. So this is from the CRNA website, and it's the English language proficiency page. And it will give you all the information that is required, as well as the frequently asked questions. So what I'm going to do is put this link right into the chat
Great.
because that will cover all of those questions. So just to give you a little bit of an idea, if your English if your English education was completed in the last 2 years, then you won't need to. Within the past 2 years, if you have these level of cell band scores, you are good to go. And in the past 5 years, if you've successfully completion of nursing education program of at least 2 years of full-time study outside of Canada with a theory or clinical was in English. Or if you've practiced as a nurse for at least 250 hours where it was delivered in English, you also qualify. So there's quite a few variations where English language proficiency can actually be met. So that's why it's not quite a straightforward answer. But if you have any additional questions, you're most welcome. If you have any additional questions, you can definitely reach out to me.
And
There's a
then
few ways.
Diana is doing her RN program and is a ways away from completing, but she's asking if she could start her search and application while still studying. And for a BN, I'll just say that we can't start your return in service term until you've completed your bridging program because you part of the return in service is you need to be licensed. And you obviously
Mhm.
can't, well, I guess some people are registered before their bridging program, but for the return in service, it just can start the day after you complete your bridging program. What advice would you have to add, Lydia?
Yeah. So, I mean, in terms of being aware where jobs are, having an interest, looking at, what kinds of things are available, but you can't actually apply for the position until you're actually competent to fulfill it. So, in other words, completed. So that's really what I would say. So there's nothing wrong with seeing what kinds of jobs are available, having like scoping the land. It's like that kind of thing, like doing a bit of window shopping. There's nothing wrong with doing that, for sure. In terms of having a look at communities, thinking about where might I be a good fit, having those kind of things, preparing your resume and getting things ready to go. But you can't actually apply until you're actually, registered and completed your program and ready to go. Yeah. Does that make sense?
Some could work, right, as a nurse
Oh,
before they
yeah. If
complete
you've
their
got your
bridging
full
program.
license,
Yeah.
yes, fully
So then,
registered, you've got a full license for sure. But you want
yeah,
to really complete your bridging so that you get your funding and that kind of thing for sure.
yeah, I
Hmm.
often have to remind everyone that doing your bridging program is such a huge commitment and just be aware of your energy levels for how much you can take on because I know you all
Yeah.
are so eager and impressively hardworking. So,
Yeah. Yeah, but I think it can be wise to do the window shopping and go,
yeah,
look at the profiles, look at, where might I be a good fit? You might think, oh, I'd like to go move to, such and such a place. And then you find out it's a very tiny and there's limited positions. But then if I look at this place, they've actually got a bigger facility and it's only 50 miles away. And, the opportunities are better there.
yeah,
So
and
those can, that can be helpful to do.
And it's nice to keep track of that too. So create a list and make your why statements. Why is this place, why is this position speaking to you? What is it about it that you are intrigued about? And then also, this is an opportunity, but it doesn't. And this is why. Like,
Yeah,
that will help you whenever you are ready to
yeah,
apply for positions because you'll already have a guideline for yourself.
yeah. And, although I was talking a lot about the more acute settings in rural, there's also a lot of continuing care settings in rural as well. So also, consider those as an option, which can also be quite lovely. Yeah.
Wonderful. Well, we're almost
It's
out
a
of time.
great place. It's also a great place to raise kids and
Yes,
have a family.
someone raised in rural, I can definitely attest to that.
Yeah. Yeah. Yeah, both of my, I'll give you my daughter, who is now a nurse working in a rural hospital, who was born and raised in rural, went back and is working labor and delivery in a rural hospital. She did her master's in London, the UK, in demography and health, but chose to come all the way back to rural to labor and delivery because she loves it so much. Yeah. She could have chosen to go anywhere, but she
Yeah,
just loves rural.
that's
Yeah.
wonderful. I'm sure she
Yeah.
had so many stories from you too. That was encouraging for her.
Yeah. Well, she was actually that particular unit used to be part of my portfolio, and she was actually born on
Oh,
that unit,
oh my.
and she now works there
Wow.
delivering babies. Yeah.
So Ray has a question. I completed my bridge to Canadian nursing at McEwen this June. Congratulations.
Yay!
But you don't graduate until November. So that is separate. The graduation ceremony is different than completing your bridging program. So that's what we're concerned about is if you've completed the requirements of your program. So for us, we say that you graduated in June. So if for licensing, CRNA had encouraged everyone to start their application 1 month prior to graduating or completing your program. So hopefully you have done that and are on your way to being licensed. And now
Yeah.
they don't have that temporary license. So
Mhm.
it is a bit trickier. You need to really focus and deal with getting your license, and then you can move on
Yeah.
to applying to
Yeah.
positions.
Yeah. Yeah. You should be able to. And they're coming up for registration fairly soon. So I would actually get on that now, right, before the rush of the renewal season starts. That CRNA gets quite busy during renewal season, so you might want to, contact the registration people early and
And
chat to
if
them about that.
anyone needs some resources and supports, with the help of Lydia, I've put together a document that has, and with our mentorship event the last time with CRNA and CLHA, they provided some specific resources. So we've got all kinds of links for you to go through your registration process, some online resources, YouTube channels, some books, um, exam prep courses. So if you are interested in that, I'd be happy to send it to you. Um, not gatekeeping it at all, but it is a 3-page document, so I don't want to overwhelm everyone if they're not quite ready for that. So, but if you are, let me know. I'd be happy to share that.
So I'm just putting in the chat because I was chatting to colleagues at CRNA this morning, and on July 22nd, Lisa Marie is doing a if I can spell, renewal webinar.
Okay.
So keep your eyes out for this because prior to the renewal of registration this year, she's going to be doing a webinar on, the renewal process and those kind of things. So it'll be on the CRNA website. So it's definitely worth keeping an eye out for that because it'll be on July 22nd.
Okay.
So you
And
might want to keep an eye out for that.
if you're not looking for the renewal, but you just want to learn about the process, then you can
Yeah,
find that that
Hmm.
recording on YouTube, or in the last BN update, I had the link to the YouTube page. So you could rewatch that if you haven't already. Okay, well, I will wrap things up. Thank you so much, Lydia, for sharing
Oh,
today. It was so
you
great to
are
have
so welcome.
you. And thank you to everyone who came. It was great seeing you, and I will see you at our next BN Mentorship Network event. Have a great day, everyone. Bye.